Hi, everyone. Welcome to today's Legal One webinar on Proms, graduation ceremonies, and the latest public health guidance. We're very happy to have you here with us to talk about these important and timely issues for us to work through together. My name is David Nash. I'm the director of the Legal One program. Very happy to have with me today, as we have for so many of our programs dealing with public health issues related to our public schools, Dr. Wayne Yankus. Dr. Yankus is past president of the New Jersey chapter of the American Academy of Pediatrics and a longtime school physician, and prior to that was a teacher as well. So Dr. Yankus, thank you again for being with us today.
You're very welcome. Glad to be here.
We have with us as well Rebecca Gold. Rebecca has been just a tremendous resource for us on so many of our programs, our webinars, our affirmative action training, our human resource training, and so much of what we're doing on a number of fronts. Rebecca is an experienced director of human resources, director of technology, and overall guru on so many issues in our schools. So Rebecca, thank you as well.
Thank you, a pleasure to be here.
We will have joining us a little bit later in our program, and we're very happy to have joining us Mackenzie Wilson. Mackenzie is Deputy Chief Counsel for the Office of the Governor, and she is juggling, as you can imagine, representatives from the governor's office have to do a number of presentations, but will be joining us hopefully in 15 minutes or so as we work through our presentation today. As we do work through this presentation, for many of you, you've been part of Legal One presentations before, and you understand that we're giving you the latest legal information, but not giving you specific legal advice. We do, of course, encourage you to ask questions. We welcome them. If you ask us a specific question about perhaps how your district is addressing proms or graduation or other similar events, we're going to assume that you're asking us a hypothetical, and we will work through that with you. So just recognize that, but we certainly welcome your questions as we go. As far as our game plan for this hour, we do want to step back and just take a little bit of a broad look at where we are as a state and nation. And there is lots of very good and encouraging news for us to look at. Of course, we're going to talk about the latest guidance from New Jersey Department of Health, CDC, the governor's office, and we will hone in as we do that on the latest guidance regarding proms, graduation ceremonies, other end of year large gatherings that school districts might have. And as we go, Rebecca Gold will keep an eye on any questions that folks might be typing in. So Rebecca, as we go, just let us know about questions that you see.
Absolutely.
We will, of course, be recording today's session as well. So all of our participants will, within a week or so, have access to the recording from today's session. So just to take a moment on the big picture, it's hard to fathom this, but 10% of the nation's population has been formally diagnosed at one time or another with COVID. Dr. Yankus, could you have imagined this a year and a half ago?
I don't think any of us could have imagined how widespread this would be. And to complicate matters, how many people were actually positive for the disease but were asymptomatic transmitters?
Absolutely, and that has made this much more difficult. And I think, Dr. Yankus, it's not unreasonable for us to believe that the actual number of folks who have contracted coronavirus is significantly higher than what we know.
I think that's correct. Considering an awful lot of people who had no reason they thought to be tested weren't, and as a consequence, probably many were positive at some point, particularly during the winter. And we don't know. These are supposed numbers. As best we can rely on our statistics from testing. and from hospital records.
And of course, we have had, the devastating impact as far as deaths and so many other lingering health impacts from this. On the positive front, we have seen, incredible progress in recent months, significant reductions since early January in the rate of new infections, hospitalizations, deaths. At the same time, a huge ramping up now of individuals who have been vaccinated. We have seen, as a result of those positive trends, new CDC guidance that provides some real flexibility, some new options for those individuals who are fully vaccinated. Dr. Yankas, as we're seeing all that good news, we do still have variants that are present here in the United States now that can pose a potential threat for us moving forward.
Right. The vaccines that we're currently dealing with, which are highly effective, in most cases, were not made with variants in mind, although we have learned that some of the variants, particularly the UK variant, is handled well by the vaccines that we're using, particularly the Pfizer-BioNTech and Moderna. On the other hand, the issue with viruses is viruses love to mutate, and they live to mutate, so that we are not done with this pandemic. We are not done with variants. What started as 2 are now 8 variants, and we expect that that will continue. The good news, though, is that as we increase vaccination, by and large, we reduce hosts. Without a host, the viruses can't live. They live to find a host. So as a consequence, herd immunity is achieved when we immunize enough people.
We've also seen, in a similar vein, significant progress in New Jersey. We have, as a state, had more than 1 million individuals diagnosed with coronavirus. That's 1 in 9 citizens who've been diagnosed. A very high number of deaths, highest in the nation on a per capita basis. But we are seeing now some very positive trends. Our transmission rate, Dr. Yankas, has fallen incredibly low, considering where we were, significantly below that 1.0 level that would show that the virus is spreading.
We're reaping the benefit of increased effective immunization, particularly now that we're starting to immunize children under the age of 18 or 12 and up, but also because the warm weather and people being outdoors more, opening windows, etc. The vaccine does not, it is a respiratory virus, and it is transmitted by respiratory droplet, but by and large, we're finding that it certainly did not do well outdoors. So as we're outdoors more, these rates will continue to drop, we hope.
And as we are seeing these positive trends, the governor has made clear that the expectation is that students and staff will be returning to full-time in-person instruction in the fall. Of course, we're always watching the data as a state, but that should be encouraging for all of us. We won't spend much time on this, Dr. Yankas, but I do think it's just important to stress those who are at increased risk. So any brief comments here? I think by now folks have gotten a pretty good handle on those who are at greater risk.
Yeah, I think as this relates to schools and families, we are well aware of older people and people living in institutions. Probably the 2 most important things to remind people of are obesity and diabetes, and that has been probably the 2 most important things for children that have actually gotten sick with the virus as well.
As far as vaccination of children, Pfizer now has been granted emergency use authorization for those 12 to 15. Dr. Yankas, that could be, an incredibly important step for us to really be moving forward towards protecting all of our children.
If you look at it from the population standpoint, Pfizer's vaccine for 12 and up and what was tested for 16 and up certainly is going to cover most middle school and high school populations. It will help with sports and teams, etc. And so as more and more kids prior to camp, prior to fall sports, are vaccinated, we will find this will be helpful for sure. Again, we know that the under 12 population, which is largely our primary schools, will not be vaccinated. And that is something we have to deal with as administrators and teachers going into the fall. But we can continue to immunize more of the population. And again, as we reduce the number of hosts, we reduce the number of places the virus can live.
So this is just important to quickly reiterate some of the things that we know. Transmission rates in schools have generally been the same, or in most cases lower than overall community transmission rates. Schools have taken all of the health protocols incredibly serious, and I think that's a testament to the work of everyone out in our schools. We know there is a much greater risk for adult-to-adult transmission in schools, although there is still some risk of student-to-adult or adult-to-student. We do know, Dr. Yankas, that where districts in cases have failed to adopt or implement mitigation strategies, that there is a significant increase in the risk. So if we let our guard down on some of the basic things we've been doing, we could see a significant change here.
The trends that we saw this spring and winter going into where we are now are exactly this. This is an adult disease that transmits to children and adult to adult, unlike influenza, which is child to adult. The other trend that we saw for a while was the fact that indoor sports often was the source of school transmission child to child, but now that most sports are going to be outdoors, we would hope to see a reduced risk of that as well. It's something we'll have to revisit for the fall.
So as we work through our mitigation strategies, we have all come to recognize that universal and correct wearing of masks is very important. It's disturbing, Dr. Yankas, when you see the images of folks with a mask and it's not over their nose. It really completely undermines the effectiveness of what we're trying to do.
Exactly. The virus lives in your nose. It doesn't live in your teeth or tongue. So the most important thing is to cover the part of the body that is likely to be the incubator. So yes, nose and mouth cover completely. That is very important.
And frankly, one of the important mitigation strategies, the CDC's guidance does still say avoid large gatherings if not fully vaccinated, and or if your immune system is compromised. Certainly we want to be thinking about that as we're moving forward and thinking about large gatherings for school districts.
Yeah, we have to take into consideration not only those people who know they are immune compromised, but we have to recognize that among faculty and among students, there will be people throughout the year who are going to develop diseases of immune compromise who don't yet know they have them. And so we are protecting others as well as ourselves by masking and practicing these mitigation strategies.
So we do give you within our PowerPoint a link to the latest CDC guidance for those who are fully vaccinated. But we want to stress this, and I know many of you understand this, but those in your school communities might not understand that the CDC guidance is just that. It is guidance. It is not mandatory. And it has not been fully adopted by the state of New Jersey. So Dr. Yankas, I think that is such an important distinction for us to be making.
It is very important for people to understand because right now so many families seem done with this pandemic and they're just listening to what the CDC says. But in fact, they are recommendatory. Your local Department of Health is in fact the one that has the authority to enact the strategies that they feel necessary for the community, because all of this relies on community spread and community elimination of the virus.
And of course, New Jersey has relied heavily on the CDC guidance as we have developed our state standards. So we're going to walk through some of the differences. But one general point, the CDC has pointed out that you're not fully vaccinated until 2 weeks after your second dose. So it's important to just remind folks of that, that it's not as if you receive a single dose and you're vaccinated, or 2 minutes after your second dose, you're vaccinated. And even if you are fully vaccinated, you do want to speak with your doctor if you have medications that you're taking to make sure they're not compromising your immune system, or have other health conditions that compromise your immune system. So Dr.
And
Yankas.
also speak to your doctor if you're not able to get the second dose on the timetable that the manufacturer recommends. We're running into that now with camps. An awful lot of young people and people that are adults who have delayed getting vaccinated are going to not be near where they got their first vaccination. So it's important to know that if your vaccine is 5 weeks after the first one, which is hopefully not the case, but it'll be 2 weeks beyond that 5 weeks before you are actually fully vaccinated.
Let me just take a moment to acknowledge from the governor's office, Mackenzie Wilson, who now has joined us. Mackenzie, thank you so much for taking the time to be here with us today.
Of course. Can you hear me okay?
Yes.
Okay, perfect. Great. Hi. Sorry to be late.
Oh, no, we're thrilled that you're with us. And also Kelly Watson. Kelly, we wanted to thank you as well for taking time to be with us today.
You're welcome. Thank you for having me.
Thank you so much. New Jersey has some very strong protocols that we have had in place since the beginning of this pandemic. And of course, they've had to evolve over time. So as of May 17th, New Jersey's travel advisory is no longer in effect. However, and there's a big however, quarantine for 7 days is still recommended for those who are unvaccinated. And the Department of Health is specifically recommending that schools have a policy in place for exclusion of unvaccinated students and staff per the CDC recommendations. So Dr. Yankas, it is so important for us to recognize that if families are traveling out of the state beyond our immediate neighbor states, chances are they're going to have a child with them who is not vaccinated.
Right. We're finding two parts to this travel advisory that came out on the 17th. First is an awful lot of families are falling on the CDC recommendation and demanding that schools honor it, and are saying that, well, I'm immunized, but your child of 8 and 9 are not. So if you did travel, they will be in quarantine. And the other part of that is now as we reach the end of school in the next 28 days, an awful lot of 8th grade ceremonies, 4th grade ceremonies, preschool ceremonies, parents want their kids taken out of quarantine in order to attend these apparent life events. So as a consequence, pressure is on schools to do away with any kind of quarantine. But since we don't always know who is vaccinated and who isn't, my personal anecdotal information for the school systems that I care for are that most schools are sticking with quarantine, vaccinated or unvaccinated. It's been too difficult to tell them apart.
Absolutely. So as of May 19th, as of yesterday, limits on outdoor gatherings have been eliminated, and that's been very widely reported in the state of New Jersey. And indoor limits have increased to 250 or 30% of capacity for venues with more than 1,000 fixed seating capacity. And I do want to stress that that means fixed seating, not temporary seating that you might be putting in place within a facility in a large gymnasium or other facility within a school. So it's important to recognize the limitations that we have to abide by. Mask wearing is still required for all of our indoor public spaces. Social distancing is still required. Maybe physical distancing is a better term, and I think we've started to try to use that terminology in some cases because we do want students to still be socially connected with educators, with each other in so many different ways. So certainly physical distancing still has to be followed. So the New Jersey Travel Advisory, as we said, is no longer technically in effect, but it is very important that schools have that policy for exclusion of unvaccinated students and staff. And I think that's going to be a little bit of a lift for schools to just explain that to school board members, to parents, to staff, to students. Everybody needs to still understand the importance of doing that. Mackenzie, if you, as I go, at any point in time where if you have any comments that you'd like to make on, of course, where we are, please just jump in as we're going.
Will do, thanks.
Absolutely. Regardless of vaccination status, physical distancing, of course, should still be followed for all of our students and, for those involved in athletics. When students are not actively participating in athletic activities, they should still be following physical distancing, coaches, referees, trainers, spectators. Minimum masking and physical distancing standards for outdoor extracurricular and outdoor events on school property. So you might ask, well, what is paragraph 1 of Executive Order 241? That does make clear that schools are still going to be required to have masking in place, masking requirements in place for those who are in outdoor activities, with some specific exceptions that we will walk through. So it's important to recognize that there's been wide reporting on the elimination of masking requirements outdoors generally. But for school functions, that is not true. We still do have those requirements in effect. The Department of Health recommends, as we said, that schools have that policy. And we do give you here a link to prior relevant executive order number 175 that would still govern mask wearing for school districts. As far as action items, based on some of the latest guidance, we have to make sure that high school sports activities under NJSIAA abide by their protocols, which do consider Department of Health guidance, so stressing that we still have to abide by physical distancing and mask wearing for those who are not actively participating in activities. And making sure that folks understand the difference between the general requirements outside of the school setting, outside of school functions, and the school setting. So Dr. Yankas, the specific exceptions that would allow somebody not to wear a mask, when doing so would inhibit the individual's health, although that is pretty rare, Dr. Yankas, isn't it?
There is almost no reason that somebody couldn't wear a mask. When this was first discussed over 16 to 18 months ago, it was if your facial anatomy had been changed, meaning you had an accident where your face hit the dashboard, or you had some sort of intranasal operation, or some previous breathing issue that prohibited you from necessarily breathing through your mouth. It is very rare that there would be any reason that an individual could not wear a mask. The second bullet point here is the one that is going to be very critical when we come to graduations. Some graduations take place on artificial turf outdoors, which can heat up to 102 degrees if it's 90 outside. Does this mean the state will allow all the graduates to take their masks off? I don't know.
So what I would suggest there, Dr. Yankas, is that we want to have those conversations now because we don't have a precise statewide formula in place, but we do have some experience in this area. Certainly NJSIAA has standards that they have developed, wet bulb standards that you might want to comment on.
Right. I mean, for sports, we've always used the wet bulb temperature, which is a combination of the temperature in Fahrenheit coupled with the humidity. And if it's over a certain level, usually over 80 degrees plus 90% humidity, that you would not practice outdoors for sports because of the risk of heat stroke or heat exhaustion. It might be used the same for graduation ceremonies outdoors where nothing is tented or you're on artificial turf reflecting heat, or simply your situation is not in any way shaded. Again, obviously, medically speaking, if someone is having trouble breathing and it's hot, they're going to take their mask off. I think it's just rather than having chaos, sometimes these things are best thought of before they start.
And it's very foreseeable that this could be an issue for many, many school districts as we're thinking about these large-scale events in June.
We have a
Correct.
question, Dave and Dr. Yankis, about the
Yes.
definition of physical distancing. Is that still defined as 6 feet pertaining to the official guidance? Or is physical distancing listed, but it also includes phrases such as to the greatest extent possible? Can you just clarify physical distancing, please?
So we are still talking about 6 feet for our middle school and high school students, given where we are on the regional risk matrix. And the greatest extent possible, does recognize that you might not have every single second the 6 feet of distancing, but you should be planning for 6 feet of distancing. So as students are at the graduation ceremony and listening to graduation speeches, they should be 6 feet away from each other. We should be planning controlled entrance and exit to the venue that is monitored in order to do everything possible to make sure we keep that 6 feet. So Dr. Yankis, this is a very important supervision issue because human nature is going to tempt everyone to ignore the 6 feet rule.
Right, particularly for outdoor and indoor ceremonies. I agree. The majority of the writing on COVID has been 6 feet of physical distancing. The issue of where possible comes in if you have smaller gatherings in smaller places, but that really is not common. 6 feet is still the common distance that has been expected of us as we walk through the issues of school as either education or as graduation, etc. I think in the fall we're going to have to re-examine that, but as we have more kids back in the building. But it has not been hard to do 6 feet with so few kids actually in the building or on hybrid or virtual learning.
And of course, it will be challenging when we are, for the first time in a very long time, having large-scale gatherings like proms or graduation ceremonies, and enforcing that standard. We do know, Dr. Go ahead.
Particularly for a prom, because essentially a prom is a dance. And unlike graduation where people are seated looking at a dais, basically what's happening at a prom is people are socializing. The issue then is for the state of New Jersey and its public health people is everybody wanted proms. Last year's class didn't get one. But the question is, how do you do a prom and keep people 6 feet apart and serve food and have a dance?
Yeah, which so will there be breaches of health protocols in isolated cases? Inevitably. The challenge for school districts is to show a good faith, reasonable supervision system so that when you see those breaches, we are immediately responding to them. We are making clear that these rules still need to be followed. And that has to be taken very seriously to the extent that we see 1 or 2 students who might decide to violate the rules. That can quickly become the majority of students if we're not responding very quickly to those issues. And, a big part of the response is sending the message constantly in advance of the events to parents and students about the social distancing and masking requirements that are still in effect. So as far as the proms, graduations, ceremony guidance, we mentioned already the 250 person limit for indoor gatherings, but there is that extra caveat so long as social distancing is in the guidance, we're saying physical distancing, so long as that physical distancing can be maintained. So you might not be able to have 250 people in a specific venue and actually maintain the 6-foot distancing. So that's part of the calculation that we have to do. Large venues with a seating capacity of 1,000 or more could host at 30% capacity indoors. That would exclude for athletics events, participants, and staff such as coaches and other staff like ushers, but it would include patrons, other members of the public, and we would still be expecting those individuals to keep 6 feet apart. So that is a tall order, but we have to make sure that everyone understands that. We do need to consider issues of access and ADA compliance. So for example, proms being held in alternate outdoor locations, or even for events, we have, Dr. Yankas, we've talked about this, events, proms being planned on a boat. And now you've got some real issues with how do we make sure that on that boat we're still enforcing the requirements for outdoor gatherings. We're making sure that the venue is ADA compliant and students can access the event. It's considered a rite of passage, even though it's not a mandatory event. Proms and graduation ceremonies are the types of events where you do have a legal obligation to make sure that they're accessible for all students. And you are making every effort to ensure that. So we certainly can do these events. We do have to adhere to those limits, including if we're doing it indoor, the 250 person number. So one of the questions that came up from one of our school principals in preparation for this event, are we permitted to conduct promotion or graduation ceremonies prior to the last day of school? There is some precedent for that. School districts have done this before, but you still have to have the expectation that students are going to be attending through the last day of school. That needs to be communicated to students and parents. And obviously that will be very challenging. It will be hard to perhaps convince all students to come after they've participated in a graduation ceremony. But you still have to make sure we're meeting the statutory requirement for school days and making sure that that's communicated to all students and parents. As far as how do we calculate indoor capacity limits, if you have a facility where you've got bleachers and a specific number of seats, and maybe for some school functions you'll have additional seating on the gym floor, our understanding is that you would not count that additional temporary seating on the gym floor in trying to calculate your fixed seating capacity. That you would not be looking at that as part of your calculation, so that would drive down what your overall capacity actually is. The guidance for indoor dances, everyone is struggling with this. Some school officials have shape plans based on wedding guidance. But Mackenzie, my read of the guidance is that schools are going to be expected to enforce mask wearing and social distancing at those proms and other large end of year gatherings, even though it will be really challenging to do that. Any comment at all on that?
Yeah, I think you spoke accurately to this previously when you said that we expect schools to make best and good faith efforts to have oversight procedures in place, understanding that particularly dependent on the population that you're dealing with, that it might be difficult to enforce in all circumstances. But we're really looking for the protocols to be in place for schools to make best efforts to implement them. That is the expectation, just as it is for any catered event at this point. Schools aren't wrong, I think, to look at the wedding guidance, because it's very similar to how a catered prom would look. And they should all be following the diet and guidance put out by the Department of Health. But we're we're understanding that this is not going to be a perfect compliant
Yes.
universe, but that you're going to be making best efforts.
And that's true in so many issues. I mean, as schools have opened, we've done an incredible job, but there hasn't been 100% compliance at all times from all students. The challenge, of course, is properly supervising and addressing issues of non-compliance. So there are some, part of my job for many years as legal counsel with the New Jersey Principals and Supervisors Association, and now as Legal One Director, is to think through some of the worst case scenarios, right? And we should be planning for some of those challenges. So if a school district was planning an outdoor graduation ceremony or even an outdoor prom, and we have inclement weather, all of a sudden there are violent thunderstorms that are forming and occurring. How do we ensure that indoor limits and protocols are followed? So this is where school districts do need to plan for that situation. If you were trying to do a large graduation gathering right outside your school building and there were 500 people there, well, you're not going to be able to have 500 people that you can bring indoors immediately and just carry out the ceremony. So having emergency response plans in place and recognizing that we will not be able to simply move the entire function indoor if we start going over these limits. That's very important. So Mackenzie, maybe this won't happen very often, but I would think it's prudent for school districts to plan for this.
Yeah, would absolutely agree. That's a great point.
What if students ignore physical distancing requirement? It will happen. It's inevitable that we'll have small numbers of students where this happens. As we said, the key is to respond to that, to signal to the students that that's not appropriate, to continuously work to enforce the standards, even as we recognize we will not have 100% compliance. We have to show the effort. What if a graduation guest refuses to wear a mask or adhere to physical distancing protocols? School districts need to make clear to parents and anyone else who is attending this type of a school function that the rules need to be enforced. And if a guest was refusing to adhere to those rules, you're going to try to persuade them to comply, but if they won't, you would be within your authority to remove that individual from that event. And if we didn't act and simply allowed that, that would spread just like it would for students, right? If you have folks who are in attendance at a ceremony and see a small number of people allowed not to follow protocols, it's going to quickly spread if we don't address that issue.
David, a precautionary note here, which is important, and I appreciate what you say, is that for those schools that have events that involve dates that come from other schools or not school at all, if the prom is not just only the senior class of high school A, B, or C, but you're allowing dates to come from outside, that those people know exactly what the rules are going to be for them.
That's very important, and that will happen. I know in some districts they have actually instituted rules for this year that, for example, the prom is limited just to seniors within that school, but many districts have not done that, and you will have students coming from other school districts who may not understand your rules. So being proactive to push out all that information in advance. We want these to be wonderful, happy events. We don't want to have compliance issues and a negative spin on all of this at the event. So we need to do a lot of work in advance to get that information out. This one, Dr. Yankus, could be real challenging. An individual who is at one of these large gatherings, either a prom or a graduation ceremony with hundreds and hundreds of others who subsequently test positive. Do you want to talk about how a school district would work through addressing that issue?
Well, essentially, it's the same thing we've been looking at, but this is going to be next to impossible. That is to say, who was within 15 minutes from within 24 hours continuously at that dance or graduation. Graduation may be a little bit easier because you know who is sitting around you. But on the other hand, at a party, much like a wedding or something to that effect, it's going to be very difficult. My guess is that we're going to look at what was the longest together episode, which will probably be sitting down and eating with masks off. And that would be where you would be for 15 minutes or longer in one continuous time frame, as opposed to dancing or on the dance floor saying hello, goodbye to people. So my guess is that it's going to be tougher to contact trace that kind of ceremony or event. But on the other hand, I think we're going to have to use our best reasonable judgment to guess where that spread.
And of course, just to remind folks, I know everyone has heard this for a year, but we're talking about individuals who have been in close contact, less than that 6 feet for an extended period of time. That shouldn't be happening at these events. We should be addressing those students or others before they've had that 10 minutes, 15 minutes, 20 minutes that they are within 2 or 3 feet of each other. We should be noticing that in less time than that and addressing that and reminding everyone to follow those protocols. But it's a huge task, especially when you're talking about so many hundreds of individuals at some of these events. We do know that last year, many schools held drive-by end of year events, and that there will be school districts doing that this year as well. Certainly that does provide another option. Obviously you'd have to work with your local municipality, local law enforcement to make sure that any activity like that is safe as far as, what's happening on the streets and within the community. So you'd have to plan that work. And we still have the same social distancing requirements that would have to be followed. So you might have individuals tempted to get out of vehicles, congregate, take pictures, and that's the sort of thing that you'd have to make clear is not acceptable, would be violating the physical distancing requirement piece that we do have to have in place.
Dave, we had one question.
Yes.
Students who are graduating included in the 250 indoor event count?
Yes, any students who are within that event would be counted. Absolutely. So it's not just 250 guests, it's 250 people. And if you're doing it indoors, everybody counts towards that limit.
Thank you.
We do have, of course, it wasn't our focus for today, but remind you, we do have some other broader guidance from the New Jersey Department of Health. We give you a link to that guidance, and it does walk through the essential protocols that we need to be following in our schools. The CDC has outlined screening and testing strategies that school districts might consider for either samples of students or staff or fully for all staff each week, depending on current community risk level. The New Jersey Department of Health sent out a survey to gauge the interest among school districts in rapid testing for schools. So Dr. Yankus, I know there are many potential benefits here, but there's a lot of complications with this as well.
Right. You need, in order to do any testing on students at school, what is known as a CLIA certificate, which is a federal certificate certifying your laboratory, which is certified on an annual basis. It costs money. You have to have the facility, the staff, and the staff training. And in fact, there is always the risk of false positives or false negatives, which would then, if it was a false positive, send somebody into quarantine who might not necessarily need to do that. PCR or nasal testing is still the gold standard for COVID-19 or SARS-CoV-2. So as a consequence, I don't know what the results will be of the May 4th survey. I'm sure many schools are doing it, many doctors' offices are doing it, but I'm much more confident with it being done in a doctor's office than in a school nurse's office. It also puts an additional burden on the employment of the nurses, who are already extraordinarily busy during this pandemic.
We have, of course, had many questions. We didn't want to, not acknowledge that there are larger issues that we're all thinking about now. So, for example, vaccinations and school employees. And school districts have been doing an incredible job of encouraging employees to be vaccinated. Some districts at working to actually make that happen. There is guidance from the EEOC that was put out in December that does talk about the potential for employers to mandate vaccination for school employees. As we are looking to move beyond emergency use authorization, that does become something that employers can consider moving forward. So we do give you some information on those issues and the EEOC guidance itself. And of course, at a couple of points here, we give you some of the guidance for the flexibilities that are available for vaccinated individuals. We also give you the latest websites because this information changes on a day-to-day basis. We constantly are getting updates from the New Jersey Department of Ed, US Department of Ed, CDC, New Jersey Department of Health. So we wanted to give you ready access to those links. Do we have other questions, Rebecca?
Yes, we do. Okay. Can you give us a definition of fixed seating?
So fixed seating, I don't have a legal definition in front of me, but it's what it would not be would be temporary seats that you're putting, for example, onto a bleacher floor for a particular event. It would be, permanently in place, established seating. Mackenzie, I don't want to put you on the spot, but anything more specific that you might want to say about fixed seating?
Your inclination is right there. When we put that language in our executive order, it wasn't intentionally broad enough to capture what might be multiple iterations of fixed seating, but really we're thinking about the delineation that you just expressed, those seats that are immovable, including bleachers versus those seats that are like folding chairs and the like, yes, that can be moved around and would just be put on a gym floor.
Okay, great. It's comforting when I've actually accurately understood the term.
We have another question that's going to make everybody smile. Any realistic tips for dance floor social distancing? And remember, we're talking about high school seniors.
I mean, you want to try to have fun with this, right? And find, fun dances that students would be doing, line dances and things that you can do and maintain that distancing. Maybe have some fun competitions that students would do. I'll open it up either to Mackenzie or Dr. Yangas if you have any thoughts on how we might frame this. Have some fun with it, but be really clear about what the rules are.
Yeah, this is certainly not my area of expertise, but I can tell you at least that our order, the allowance therein, certain couples that attend the prom event together can dance together without the expectation of social distancing. Again, I just want to reiterate, I think we all understand on our side of the aisle that this is going to be very difficult to enforce, and you'll do it to the best extent you can, hopefully coming up with some creative ways to make it as safe as possible. Again, understanding that not every young adult is going to follow the rules in exactly the same way.
Yeah,
I would agree. All I can think of is limit the slow dances, play more fast dances, and every girl should have a big orchid on her shoulder so that you can't get close enough to crush it.
Very good answer. Very good answer. Okay, we have another one regarding end-of-year trips to off-site venues. Does the school guidance on masking prevail, or is it the venues guidance? For example, trips to amusement parks, great adventure, things like that. What are the rules that they follow once they're on the grounds of the amusement park or wherever they're going?
My understanding would be that because you're talking about school functions that are taking place, is that regardless of where the students are, the expectation would be that they're following our masking and social distancing rules at that function. Is that right, Mackenzie?
I think that is the expectation, particularly when the events during school hours. I might treat it differently if there was a school hosting an event after school hours or on the weekends, potentially at an off-site location. Again, understanding this might be very difficult to enforce. I just also want to note that this has been a shifting landscape, as I'm sure you all can appreciate. The new CDC guidance, of course, with the differentiation between vaccinated and unvaccinated individuals, though they have not made those adjustments in the K-12 operational setting. And I think we continue to look at these issues as they come up. So to the extent that you see these sorts of inconsistencies, and I think this one's a great flag and something that the governor's office might want to clarify, please feel free to bring them to our attention, because we do take heed of them and incorporate them into our orders as necessary.
But
That's
also,
a great point.
Thank
but
you.
also, I'm sorry.
Go ahead, Dr. Yankis.
What also hasn't changed, if you're considering taking a class to Six Flags or something like it, and it is a school function, you still have to have your EpiPens. You still have to have your Paul's Law. You still have to have your AED somewhere around or establish that there's one there. You still have to follow through all those executive orders and codes for schools that existed prior to COVID. COVID has not stopped those things from happening. So you still have to have those children who require medicine to have somebody with them who is able to administer the medicine. So again, this probably wasn't the year to do that kind of adventure, but those things haven't disappeared.
And frankly, we're a little bit out of practice as a state at doing these things on a large scale. So certainly you want to review all of the other student health protocols that we've had in place for many years that have evolved pretty significantly and expanded over time as well. Other questions, Rebecca?
Yes, we have another question that actually goes to Mackenzie's comments a minute ago. Do spectators at sporting events need to wear masks at the sporting events? NJSIAA guidance contradicts Order 241. So we can look into that. I just wanted to mention it because it was.
Mackenzie, any thoughts on the spectator piece?
Yeah, I can address this right now. And I completely understand where some of the confusion comes from about Executive Order 241, in that it indicated that operations on school premises, which may have not been the most clear terminology, would continue to follow existing masking protocols and would not be superseded by paragraph 1 about the relaxation of masking. So that was really reference to the activities that are governed by EO 175. So EO 175 obviously is our school's EO and set forth health and safety protocols and standards. That's what the road back, the DOH, Department of Health documents on K-12 operations all sort of flow from that order. Sports activities were permitted before Executive Order 175, and they have always been governed by a distinct executive order. I'm talking about extracurricular sports activities here, not gym classes and the like. And they have been governed by the Department of Health's guidance on sports activities. So that is in part because we don't just have to worry about high school, middle school, elementary school sports operations. We're also thinking about college, club sports, those that happen in that age group of K to 12, but outside of the school context. They all have to sort of be treated similarly. So we've had those separate rules. So to answer the question directly, No, spectators at extracurricular sporting events, even if they occur on school property, those spectators do not need to wear masks outdoors in accordance with paragraph 1 of Executive Order 241.
Thank you,
That's very
Mackenzie.
helpful. Yes.
Thank you. That's very, very helpful. Thank you so much.
Of course.
Another question on the changing landscape, as we said. We have a comment here that they've heard that in a lot of the news media that 50% capacity for 1,000+ fixed seating has been reported. We mentioned 30%. Has that changed, or can we just clarify that, please?
The 30% has not changed at this time in New Jersey. I don't know if that's in another locality, but that is something that we're certainly looking at in terms of prospective changes. At this point, we don't have the limit on the outdoor venues, so indoor would certainly be the next step, but it remains at 30% for now.
Okay, great, thank you. And one more here. Wedding guidance references groups on dance floors. Would that be the appropriate for schools, which you did mention was similar, but more importantly, what constitutes a group?
So could I think to get specific, if you had 4 students who were close friends, could those 4 students all be one group who are very close to each other at a dance?
Yeah, I'll say that generally when we've talked about groups in our guidance and our orders, we're talking about the individuals that enter an event or a facility together. In a restaurant, that would be the table that's going to be seated together. At an amusement park, it's the family coming in a car together, et cetera, et cetera. So obviously there are often groups of kids that come in the same limo to prom, who maybe would be seated at the same table. We would consider them a group.
And that will be a real implementation challenge. So in order for that to actually be monitored, school districts would need to know that in advance. There would have to be some process to sort of understand who the students are in any particular group. Otherwise, that would be really difficult to actually monitor in the moment and to accurately assess who was actually in that group. So that will take significant advanced planning for us to know who those groups are and to communicate the difference between those who are in that small group and interacting with every other student.
Yeah, completely understand and appreciate that. And I think we did have that in mind as we were crafting the rule. I'll also note, David, that standard is difficult for us to enforce.
Yes.
It's not like at a wedding, say, because I don't know that we have police officers walking into a prom, for example, but at a wedding, that a police officer would be able to walk in upon a call that, groups who did not come together are interacting on the dance floor and be able to enforce that rule. That's just not something that's realistic. So I would keep that in mind as you're moving forward. I think this would be a very difficult rule for us to enforce.
Absolutely.
And I did read someplace that some places are using wristbands. Again, everything you said is true. It's impossible to enforce because they're going to mingle on the dance floor, but they use wristbands to identify who walked in together and who's a group. But that's
a good point, Rebecca, because that something easily visible that identified you as in a particular group, could be helpful.
Right. I think that Mackenzie's right. It's close to impossible once they're on the floor. Okay, and another question here. Does guidance change if parents organize and run a dance social after the last day of school in a park or venue off school grounds?
One thing I would say about that is that we need to be incredibly cautious, because if schools are doing anything that is supporting, encouraging participation in that function, it starts to look awfully similar to a school-sponsored function, where you would say that school rules need to be followed. So, Mackenzie, I would imagine that school districts would have to be completely hands-off if parents on their own we're deciding to do some sort of an outdoor function, and really make sure that they're not in any way involved in that process.
Yeah, I think that's right, David, and you would be the expert there, I think, on what would allow them to do that appropriately. But if it truly is completely separate and apart from the district, then I do think that would take it outside of the K-12 operational guidance realm. If, for example, they're just having what I would at that point consider it a private gathering in a park or some similar setting, then it would be guided by our rules that are generally applicable to public activities and operations, and they would be able to remove masks, for example. They would be subject to no, we don't have an outdoor gathering limit anymore. So it would make a tangible difference.
Yep, absolutely. So great question. Just again, that caution, you wouldn't want anything that shows that school principal, teachers, administrators, anyone was sort of actively involved in encouraging or supporting in some way that sort of a planned event. That would truly have to be something done by the community outside of the schools.
And the last time's ticking here. I know we said this, but this question came up about 4 times, so I'm going to ask it on behalf of our people who may have come in a little bit later. Do spectators, or meaning the guest, need to wear masks at graduation promotion ceremonies?
At an outdoor?
It didn't specify, so if you can specify in your answer, it doesn't say.
So Mackenzie, I believe, can you talk to that for the spectators at the outdoor ceremonies?
Yeah, and certainly this might be in the same ilk of the outdoor sports competitions. It might not be entirely clear from the order, so I'm glad to be able to clarify now. For those sorts of activities that may be sponsored by the school but are like extracurricular in nature outside of traditional school hours, an event that's not actually part of in-person instruction, if it's outdoors, the spectators are not required to wear masks, regardless of social distancing or vaccination status. Indoors, they would be.
Yeah.
Thank
So
you.
that's great. That's a very good clarification. Absolutely.
Thank you. That makes it very clear. Thank you, Mackenzie.
So with that, I think we're going to look to conclude this session. I want to thank you, Mackenzie, for, I know how incredibly demanding your schedule is. So thank you for taking the time to be here with us today.
Thank you for having me. And my email is just my first name dot my last name at nj.gov. If anybody has any targeted questions, I'm happy, to the extent I know the answer, to help you. And if I don't, to find the appropriate person to get you the answer.
And we certainly encourage folks, if you have questions, you can also email us following today's presentation at legal1@njpsa.org. And we're happy to follow up with any of our participants. Dr. Yankus, let me thank you again, as always, for just your great insights on all these topics.
You're very welcome.
And thank you, Rebecca. You're always a wonderful partner as we're working through our webinars.
Oh, it's a pleasure. And we have a lot of thank yous in the in the chat room and the questions, and they're saying awesome job and thank you all so much.
Okay. Well, thank you everyone for being with us today. We do look forward to the day where we'll be able to see all of you in person again, but it's wonderful to have you here. Be safe and be well, and we look forward to having you at a future Legal One session soon. Thanks, everyone.